Thanks everyone for tuning in and joining the City of Fall River's COVID-19 Town Hall. We as a city have been challenged and have seen the devastating impact of COVID across our community. All aspects of our lives throughout the last 12 months have been disrupted. There's no doubt about that. Fortunately, there's a light at the end of the tunnel, and it's called vaccinations. As a city, we decided to host this town hall to provide an opportunity for trusted physicians from Charlton, South Coast, Health First, Primacare, Star, and St. Anne's Hospital to answer anybody's pressing questions and concerns that our residents have regarding the COVID-19 vaccines. Let me introduce a really distinguished panel. Dr. Alizo Lacerda de la Cruz. He's an infectious disease specialist and chairman of the Infection Prevention Department at South Coast Health. Dr. Eric Vaught is the Chief Medical Officer at Health First Family Care Center. And Dr. George Maxted is the Medical Director at Star. We're also joined by Dr. Martin Vogel, who's the Chief Medical Officer at Primacare and an Inpatient Medical Director at St. Anne's Hospital. And of course, our own Health Board member, Dr. Stephen Gagliotti, who is a physician upon Robeson Street. I want to thank all the panelists for being here today and all you've done for our community over this last year. We couldn't do it without you. I'd also like to introduce Tess Curran, our Director of Health and Human Services, who will be our moderator today. I've worked with Tess every single day since this started, and she is not only a very, very diligent working Director of Health, but she's a stand-up person and does whatever it takes to get us through this. And I really do appreciate her. But with that being said, take it away, Tess.
Thank you, Mayor. And I too would like to thank our panel for all that they have done. I know I've worked closely with many of you or members of your organization over the last year, and we as the health department and city are incredibly appreciative of all of your work. So so thank you for that. And I'm really happy to have you all here today to be panelists for our town hall. The goal of today is really to educate our community about the benefits of the vaccine. And again, like the mayor had mentioned, answer some of the questions that had been submitted to us previously before this forum. I just did want to make a note, a few notes. I'm going to kind of go into some details about vaccine access and the timeline before we dive into the panel discussion. But I do just kind of want to start by mentioning that, that while we do have a panel of physicians, if individuals who are listening have specific medical concerns or advice, then they should really consult with their own practitioner about the specific medical questions, and that, the advice here on the panel should kind of be applied broadly. But if you have any specific questions, please consult with your own provider. So I'm just gonna dive into, if I can, Alex, if you could go to the next slide. It doesn't seem like I have the ability. Great, thank you. So the distribution timeline has been set up by the Massachusetts Department of Public Health, and that was based on an advisory panel consisting of public health experts, providers, and they really made the determination as to who would be getting the vaccine and when, and that was based on risk level as well as life perseverance. So that's really what this timeline has, how this has been developed and how we're following it here in the Commonwealth. Alex, if you could go to the next slide, please. Great. This is exactly where we are right now. As you'll see, the current phase 1 and then the 2 bullets within phase 2 is where we currently are. So individuals 65 and up, and individuals with two or more certain medical conditions. Those conditions are outlined on the state website, so I would encourage folks to check that as a resource, are now eligible. And then starting tomorrow, K through 12 educators, child care workers, and school staff are all eligible for vaccines. Again, this is ever changing. People are being added, the phases are being activated at certain times. All the timelines on the state website are estimates. So, I would encourage residents to check out that state website for the most up-to-date information about eligibility and the time frame. Alex, if you could go to the next slide, please. So when you are eligible, you'll be able to find an appointment on the vaxfinder.mass.gov website. That routes you to find appointments nearby or any availability in the area or throughout the Commonwealth. That has the pharmacy locations, the mass vaccination sites, and then some of the smaller, kind of more independent locations. As we all know, the governor has been pushing folks to get to those mass vaccination sites. The smaller clinics are not kind of the main route of a vaccine at this point in time. So locally, we have 2 pharmacy locations in Fall River. There are vaccine opportunities at the community health centers, and then we have the Dartmouth site nearby, which is a mass vaccination site. People who are 65 and over and have 2 or more of the certain medical conditions who do not have access to the internet. So that's the key here. You can't have internet access to call 211, but if you don't have internet access, then you can call that 211 line and they'll be able to help provide you with an opportunity to get a vaccine. That also has multiple languages, so people should take advantage of that 211 line. Next slide, please, Alex. If people do need help getting to a mass vaccination site, Mass Health does provide free transportation. So again, you can call Mass Health or your health plan to schedule free transportation. So please keep that in mind to get to one of the mass vaccination sites. Folks who do need that should certainly take advantage of that service. Next slide, please, Alex. And I just want to reiterate that there is no cost associated with receiving the vaccine. We certainly don't want that to be a barrier. So the vaccine is free for all Massachusetts residents. If anybody asks you for a credit card number or for payment for the vaccine, that is not, you should not, hand over that information as the state is making this as easy as possible for people. So please don't try and pay for a vaccine. That's a scam. And you don't need a license or any identifiable information or a social security card number to bring to a clinic. You can really just show up and you should be able to receive the vaccine. And next slide, please, Alex. Getting the vaccine will not impact an individual's immigration status. So regardless of your immigration status, you have the ability to receive the vaccine, and we strongly encourage you to do so. We will not ask any proof of documentation or any anything regarding your immigration status. So please, if that's a question for anybody on who's listening in, please know that that's not taken into consideration. And so with that, I'd really kind of like to pass things over and open up our discussion to our panelists. And I do have, like I said at the start of the call, we did have a number of questions that had been sent to us over the course of the last several weeks. The first of which, I'd like to kind of start with just providing our residents with a sense of, what is a vaccine and how do vaccines work? So if our panel we can just kind of dive right in. Dr. Fogel, could you maybe kick things off for us?
Sure. Let me actually back up 1 or 2 steps from the vaccines just to give a little bit of context, and let me make a couple of comments of my own. That these are unprecedented times, and I know everybody has used that phrase over and over again. Infectious diseases are not new. We've had them. This one is different in that the magnitude of it, the amount that has devastated the population across the whole country, the quickness that it spread across the country and across the world is different than most other infectious diseases. Diagnosing infectious diseases is not brand new in the world of medicine, and treating them and vaccinating isn't brand new, but this is still something that's really quite different. The part that's a few of the things that are different is the quickness that science has been able to move ahead, telescoping what usually takes years or a decade of scientific work to sleuth out the particulars of the disease, how it works, to create a vaccine and to roll out a vaccine this quickly is something that we've really never seen in the history of medicine. I know that scientists and physicians are faulted because, gee, a year ago we thought this is what was happening, but we have learned so much so quickly. And I think everybody has been pretty nimble in changing our outlook and figuring out basically what to do next. The final thing I'm going to say, and I'll get to your vaccines, is that this has provided an opportunity for cities like Fall River to come together in a way that we've never done before, because we've never had to before. And I think it's a credit to the mayor and to Tess and the local government for creating a forum where Primacare, South Coast, Health First, STAR, all the different medical entities that have been excellent in their way in Fall River have really drawn together in a way that is gratifying for us to see, because we slug out medicine every day. But I think the way that everybody has worked together has really been a credit to the city and to everybody who practices medicine. So I think you asked me a question about vaccines.
I did. I just kind of, how do vaccines work?
From the perspective of a chief medical officer and somebody who was a vascular surgeon for most of their career, I'll tell you that vaccines work by basically tricking the body into recognizing what is ultimately going to be the virus that's infecting you. The vaccine is not giving the patient the disease so that they are infected and then mount a response. It actually is a trick where in most of the cases that we're seeing right now, a patient is given a shot, the body creates a protein that mimics the actual virus. The body then mounts a response to that protein so that when the actual virus shows up, the body is ready to fight the virus and prevent the actual infection. So for my medical colleagues, how was that? Was that pretty close?
And that was pretty accurate, Dr. Fogel. It's a trick or a primer. You teach your body to fight an infection that will face in the future by injecting it with a partial, in the cases, and sometimes the virus itself inactivated or dead, and have the body make those protective proteins, those antibodies that when you face the real threat, then your body's already primed and has those antibodies set to go and fight that infection. So well said.
Yeah, I think
I just wanted to add.
I think it's hard to find anybody alive today that hasn't been vaccinated to one thing or another. If you've gotten a tetanus shot or some of us are old enough to have gotten the smallpox vaccine variolation, and so we've all been vaccinated, and it is the number one way that we have of eliminating and preventing infectious disease. I mean, antibiotics are cool; they help. But if you want to eradicate an illness, you have to vaccinate. You have to use the immune system.
And I think going along with what Dr. Fogel said, vaccines have been around obviously a long time, and a lot of people wondered how, if it takes so long normally, how did they get this one done so fast? And if they did it so fast, how can it be safe? And I think people have to remember that the research going into, everybody knows it as COVID, but it's actually one of the SARS viruses. They started developing this years ago based on, initial research in HIV, and then with the SARS virus from a few years ago. So the basics and the foundation was already established, and we just needed to finish up the work that was done before, and then use the specifics of this virus to program this vaccine. And that helped us get this response so quickly. So I think people have to, there's a lot of talk about the virus not being safe because it was developed so quickly. But I think that if you keep in mind that this has been going on for a while and that they were ready for this, that people should, go along with the safety that has been established in the first 50 or 60 million doses that have been given.
Yeah, and thank you for bringing that up, because that was another question that we had received about, this timeline was it seemed to be so quick, that how truly can we know that the vaccine is safe? So if maybe Dr. Lacerda, if you could maybe go into the aspects of clinical trials and how do we know that this vaccine, or the three that are available, so the Pfizer, the Moderna, and the Johnson & Johnson vaccine, are safe, and the efficacy behind those vaccines?
As Dr. Gagliardi was mentioning, there's a few things that made this vaccine development in a course of a year possible. And one is that we knew we have two coronaviruses before of the same family. We have the SARS and the MERS, the SARS-CoV-1 and the MERS. So scientists already knew which part of the virus needed to be targeted, that spike protein. They knew that that's what these type of viruses will use to get into access into our cells. So they knew exactly what to target for the vaccine. The second thing that is important is that the technologies where the vaccines are based have been already worked on for decades. mRNA was being used to treat, for attempts to treat cancer cells, and also for other viruses like Zika virus. They tried that before, so scientists already had some experience working with that platform. And with the adenoviruses, we've done that forever for vaccines. So the using a carrier virus that doesn't hurt you, they already also knew that and what to target. And then the amount of resources that were placed into this is something that we should not take for granted. When a vaccine is being developed, usually it's one single company putting all their money to do a vaccine. And, that takes time, and they don't have all the resources just to allocate them all at once. And this time you had a partnership with different governments pouring millions of billions of dollars into making this happen so quick. One thing that I want to mention that has to be clear, the vaccine happened quickly, but no corners were cut. So all the phases that you go through to approve any other vaccine were taken for these three vaccines. And that's basically, you go to the lab, and in the lab you test if the vaccine target that you chose will elicit antibodies that will block the virus actually, and they play with the virus in the lab. And then they give it to a couple of hundred people with different doses, and they measure how much you need to be effective. And then a couple of thousand people, and then you saw the last phase 3 trials when they enrolled 60,000 in one hand, 50,000 in the other. So all the specific steps you have to follow to approve every other vaccine were followed with these three vaccines. So the safety and efficacy were proven the same way we've done it before. So that's why we can be confident that they are safe and effective.
Thank you. So we know that the vaccines are safe, and we know kind of what vaccines are. So Dr. Vaught, if you could maybe explain to us, what are the benefits, if somebody's on the fence about getting the COVID vaccine, they're not quite sure if they want to get the vaccine, why should someone who is eligible or who may become eligible, shortly, why should somebody get the COVID vaccine?
That's a great question, Tess. And I think going back to Dr. Lacerda's point about the way the trials were done, we have to keep in mind that the endpoint of a successful vaccination in this case was to prevent serious disease and hospitalization. And that's been our key thing throughout this whole COVID response, is really decreasing the burden on our hospitals and ICUs, not only in the city of Fall River, but across the entire nation. And so the vaccine proved effective to decrease your likelihood of having to get hospitalized or even admitted to the ICU. And so it's not only protecting for yourself, I think it's protecting for those that are in close proximity to you. If you care for elderly parents or other loved ones that may have risk factors, getting vaccinated yourself can have that protective effect, not only for yourself, but then those that you're in close contact with each and every day.
Thank you.
I think it's important there with Dr. Baldi saying, all of three of them are very, very effective doing what he was saying, preventing you from going to the hospital or dying from COVID or needing to be in the ICU. Because I know people have been, the J&J vaccine, I don't want to take that one because it's less effective. The end goal of all these vaccinations is prevent you from getting some bad disease that you need to be in the hospital or dying. And all three of them are excellent doing that.
Yeah, I want to chime in on that too, that it's really unprecedented. We've seen the quality of studies being done for these vaccines. The Moderna vaccine, I think, was 30,000 people, and it was what they call double-blind controlled. In other words, they divided people in half, the group in half, and some got vaccines, some didn't. Nobody knew who got what. And within a short period of time, it became very clear that people who did get the vaccine, when they opened the envelope, as it were not getting infected, and the people who got the placebo were. And the protection was estimated at 95% for Moderna, and same thing for Pfizer, and now the J&J vaccine, maybe not having quite the high numbers, but we're used to seeing efficacy numbers of 60%, 40%, and we used to think that was great for flu shots. So here we have vaccines that are performing at extraordinary levels.
And Dr. Maxted, go ahead, Dr. Fogel.
No, I was just going to mention one more thing. It's interesting if you listen to the conversations that are happening all around us. And I mean, with our families and on street corners and everywhere else, that because of the internet and because of so much transparency, there's so much more information that's been sent out to the world, actually, that non-physicians, non-scientists are now having legitimate debates about the efficacy rates of 75% versus 90%, and which one would you have? And that one puts an mRNA in you. And these are words and phrases that have always been held closely by the scientific community. And to us, it's the scientific method of you pose a question, you do an experiment, you have people be tested, and then you look at the results. To us, it's basically second nature, but it's now been exposed to the world, and it's happened so quickly that it's fascinating to hear what the debates are out among the public, choosing which vaccine and why they would choose one over the other. When Dr. Maxted makes it very clear that for flu and some other diseases, we would be thrilled with a 50 to 60% efficacy rate, but now our families are debating 90 versus 95.
Yeah, the one I like is the people that found out they were in the placebo group of Moderna, the Moderna study, were begging, said, please, can we get the vaccine? Hey, you guys gave us, water. We want the real thing. and they were able to get it when they found out that they actually were in the placebo group.
I think you know it's really great to hear that you know people shouldn't be vaccine shopping, and that we really want as many folks to get whatever type brand of vaccine, whether it be the Johnson & Johnson or the Pfizer or Moderna. So I think that's really helpful to hear, because we have often heard, you know, we got a number of questions about that kind of vaccine shopping. So so thank you for reiterating that. And you know, Dr. Fogel, maybe we have also received some questions about, you know, I've already had COVID, so do I really need to get the vaccine? So if you could maybe expand upon that, and anybody else who may chime in after Dr. Fogel as well.
The short answer is yes. And our best explanation is that there is a certain amount of immunity that we feel probably happens, that we call natural immunity, after one has the disease and has coronavirus, that your body has created antibodies so that you are probably protected for a period of time. We're accused of not knowing exactly how long that period of time is, and that's actually true. We're not sure. We can extrapolate from what we know from other diseases and the way we know antibodies work. But at some point, even after having coronavirus, one could still get reinfected months and months down the road. Remember, we've now been doing this for a year. So someone who's had coronavirus 10 months ago may or may not still be protected from their original antibodies, and a vaccine is a great idea. In their case, it may act like a booster to re-inoculate them, to let them build up more antibodies, but we're in this for a period of time. It's not just a one infection and then you're good forever. So the answer is yes, we would all advocate getting vaccinated.
Yeah, but I would add that there is some thinking out there that if you've had COVID before, that maybe perhaps a single shot would serve as a significant booster. That hasn't been fully established, but you know there's some talk about that.
And Dr. Lacerda, as our infectious disease specialist, you know, there are a lot of questions about what the vaccine efficacy will look like with new variants or emerging variants. And even if there may be this COVID vaccine will become kind of an annual vaccine like the flu shot. So would you be able to take a stab at those questions?
On the first one, which is what are the variants going to do to the vaccine, we don't know for sure. There are at least two, that the one that we call the Brazilian one and the South African one, that has shown diminished efficacy in the lab, although we haven't seen that in real time, real world, and the immunity is two-pronged. So there's your antibodies, and there's also a part of the immunity that is carried out by cells. So it might be that in the lab we see a decrease in the effectiveness, but when we are faced in real life with the virus, we might not get severely ill or needing to be hospitalized. So there's more information that needs to be collected about that specific part. So we are even with like the Johnson & Johnson one was tested late, the latest one to be tested. We saw that the efficacy to prevent hospitalizations and death was still 100%. So it might be that that's not an issue. With the mRNA vaccine, the Pfizer and the Moderna, they are prepared to tweak the vaccine a little bit if needed. If we see a strain, a variant there that makes the vaccine less effective, and we might need to get a booster shot with the new construct, the new build of the vaccine. In terms of a yearly vaccine, I think we should be prepared for that. Natural infection from coronaviruses typically does not give you long-lasting immunity. Human coronaviruses you can get every year, like the common cold, and the SARS and the MERS do not seem to also, the natural infection to give you long-lasting immunity as in other diseases like measles, for example. So we should be, I think it's a reasonable thing to expect to be vaccinated every year or every 2 years, depending on the vaccine.
One comment on the different strains. If this virus seems to have a good ability to mutate fairly quickly, and one way of preventing that is the more people that are vaccinated and the more people that are immune, the less virus is out there, and you decrease the number of possible hosts for the virus. So there's less places for the virus to go, less chances of it mutating. If you really whittle down the population that's susceptible, there's less places for the virus to go, less replication, and less mutation. So that's one benefit of getting as many people vaccinated as fast as possible, is cutting down on future changes in the strains.
Yeah, I think that's important. If this virus becomes endemic, in other words, if we vaccinate maybe half of the population, but it just floats around in the other half, we'll be dealing with this for a long time. The whole concept of herd immunity, which is controversial, but the idea is to, like you're saying, vaccinate as many people as you can and as quickly as you can to stop the ability of the virus to mutate and create more variances.
And I think, a lot of people get confused by that term herd immunity. If there is herd immunity, it doesn't mean if you're not vaccinated, you're somehow protected because everyone else has the vaccine. You're still going to get it. So if you don't have the vaccine, theoretically, eventually you will get COVID. You may get sick, you may not, but you don't have immunity because everyone around you does. That's not herd immunity. Herd immunity is everyone around you is vaccinated, so there's fewer and fewer people that you will come in contact with that will have the virus. So you're not protected by everyone else. And if you don't get the vaccine, theoretically you could eventually will get COVID, and then either get very sick or maybe not, but you're taking that chance.
Tess, if I can make another related point. Many people may be hesitant to get the vaccine because they have heard that people had the infection, they weren't so sick, it was a minor thing, and they just really haven't encountered anybody who was on a ventilator or who died from coronavirus. There's really no virtue in getting the disease, and vaccination is really the best strategy that we all have to preventing ourselves from getting the disease, and then herd immunity in the population perhaps, but there's really not a great argument to be made for leaving yourself open and allowing yourself to be the one who gets the infection, because then you'll be okay, because so many other people have, I guess, gotten away with it or done okay with it.
Thank you. That was the concept of herd immunity was another question that had come through. So thank you all for addressing that. Some other kind of questions about specific populations in terms of who should get the vaccine. Dr. Gagliardi, we did receive some questions about people who indicated that they like to have a baby or they'd like to start a family one day. Should they get the vaccine, as well as people who are currently pregnant and or breastfeeding? What are the considerations around that?
Right now, the recommendation from American College of OBGYN is that pregnant women should get vaccinated. Kind of like we recommend for the flu. You're better off with the vaccine. So far, there's no signs of any problems with pregnant women getting the vaccine. But if you get COVID while you're pregnant, you're going to be much worse off. Just like patients who get the flu while they're pregnant do much worse than when they're not pregnant. The whole thing about I want to have a baby, I've heard that before. I have no idea. I don't know if that's a Facebook thing, but I don't see how there would be any mechanism that it would affect future fertility. It's it's immunity based. You're developing antibodies and memory cells. It really has nothing to do with conception or early pregnancy. You're not getting virus put in you. So I would say that people who are not getting the vaccine because they think it's going to affect future fertility is not realistic. That shouldn't be taken into consideration.
That's an important point that you mentioned there. That is not live vaccines. You're not getting the virus, the live virus. You're not getting in any of the 3 vaccines. So that concern of you getting sick from the vaccine, meaning getting the virus from the vaccine, is a misconception. People shouldn't be worried about that. You do not get the virus itself live and like attenuated as in other vaccines. These are just little pieces of the virus in one case, or just a sequence of a protein from the other. So no real concern should be from that.
Yeah, I have a daughter who is pregnant now, and you're right, Dr. DiGagliari, about the ACOG, the College of American of Obstetrics Gynecology. Not only do they recommend that pregnant women get it, they recommended against necessarily having to have a consultation with a physician. They just said, get it. So, I've been getting my daughter's face and say, you're getting the vaccine, So pregnant women in particular. And the other thing is, that the fertility thing started with this scientist in Germany who came up with this theory that somehow the virus, the vaccine would cause a problem with fertility based on the structure of the proteins, and it was totally bogus. But it got a lot of spread on the web. So I find myself having to take that apart. And I tell my patients, don't use the vaccine as a form of birth control.
That's right.
You not only, if you get COVID, that's another story. That can definitely affect all areas of your health. But the vaccine itself is going to keep you from getting sick, and it's not going to have any effect on fertility.
The other thing I heard was that they use fetal tissue in vaccinations, and as far as I know, that is not true.
Yeah. No, at all.
No.
So we know the vaccines are safe. We know that they're effective, and we know that pregnant women should get them. That people who are currently eligible should all be trying to actively get the vaccine. So for people who are now ready to to book an appointment, Dr. Vaught, can you kind of talk to us about maybe some of the symptoms or the side effects that may occur after an individual receives their first and or second dose?
Yeah, that's a great question, Tess. So as we've rolled out this vaccine to our staff and to our patients in the community, we continue to collect data about what are they experiencing after they get the vaccine. And those responses can be wide ranging. The patients can experience just some arm soreness for a day or two after the shot is given, to having fatigue and body aches and even feeling fevers a day or two after the vaccine. And so we often prep the person getting the vaccine to expect to have an immune response, that you could have a very local response where you get the injection, but you could also have a whole body response, and to really plan your time and your day following the vaccine accordingly, so that you can, if need be at home, have access to over-the-counter Tylenol and Motrin to help with the body aches and the fevers that you might get. But to really just plan for that. We then, when we give the second dose, patients are telling us that yes, they may have had a little stronger response than they did after the first dose, and that can be explained mostly through we're trying to boost the immune system, and so that first dose maybe didn't elicit a response that we were, but the second dose then does. And so again, I think people just being prepared for having some significant side effects. And then if that doesn't occur in the day or two following, then that's great, and they can go on with their daily life.
And to that point, if somebody doesn't experience any side effects to the vaccine, does that mean that the vaccine didn't take or isn't effective if they aren't experiencing any symptoms?
No, that's not been
No.
shown to be the case.
My anecdote on that, which is, and you're right, Eric, is an elderly woman that works for us who got the vaccine, had no symptoms at all from the vaccine at all, went to donate blood and was called by the blood people to let her know that she had very, very high antibody levels and they wanted to use her plasma for treatment. So yeah, no correlation at all. You can have very, very strong antibody response without any symptoms.
And we have an antibody test at our office, and we tested, quite a bit of the staff, and they all had varying degrees of symptoms after their second shot. And everybody showed a great immune response, whether they had minimal symptoms or, a little more severe, but everybody showed great response to the vaccine.
One other thing to point out to people is that there's a significant number of people walking around with asymptomatic coronavirus infection, and they very likely have a reasonable antibody response. They never had any symptoms even to the disease, much less to a vaccination. So there's no hard and fast rule that a sore arm, a high fever, fatigue means that you had a good response, and the absence of those means that you were a non-responder. There is no good correlation there.
And Dr. Fogel, if you could, for people who have allergies, what can they expect at their appointment? And should somebody with allergies get the vaccine? And just a caveat again that, if you have any certain medical conditions, that we really do encourage you to speak directly with your doctor. This is just general information.
Boy, that makes a lot of common sense. It just doesn't happen to necessarily be true. That people are obviously going to be concerned because they're sensitive to medications, or I have allergies to strawberries, or, I mean, we've heard them all actually, but I'll defer to others who may know better than me, but I'm not really aware of any other allergies or predispositions making it risky, particularly to have the coronavirus
That's
vaccine.
correct.
The only caveat that the CDC and the Department of Health will say is that if you're allergic to any of the components of the vaccine, which is this circular argument that it's a new vaccine that is really very standard the way that it was created. So it's like the ads on cable TV. Don't take this fancy new medicine if you're allergic to this fancy new medicine. There's not too much that you can do with that, but although it may make logical sense that you're sensitive or an allergic person, that really isn't correlated to having any kind of a reaction from the vaccine.
That's correct. Food allergies specifically, especially, don't have any contraindication. And it's a common question that we encounter. So people that have allergies to peanuts or strawberries or things like that shouldn't have a concern. The only caution that we have is for people that have had severe reaction to other injectable medication. And that's still not a contraindication. It just requires that there's a little bit more of a history taken before you get the vaccine. So if you had a severe allergic reaction to other injectable medications, then you want to have that conversation with your physician and get a little bit more of a history before you get the vaccine. And this, I'm talking about the mRNA vaccines. With the Johnson & Johnson, there's less of that warning, but that would be the only case where people want to have that conversation with their physicians before going ahead and scheduling their appointment. Otherwise, other allergies, not a problem.
Tess, if I could make one more point, when we talk about the side effects after the vaccine, and I would encourage people to talk to their primary care physician if they are experiencing side effects, is that we still see a lot of COVID disease in our community. And so the potential is there for you to be infected a day or two before you get the vaccine. And then it becomes very complicated to know if it's a reaction to the COVID vaccine or if you're displaying symptoms associated with COVID disease. And so again, there's a lot of history taking and then potentially lab tests that would need to be done if in fact someone has those types of symptoms after getting the vaccine.
And that's one of the things that's showing up on the web too for all of our patients who cruise the web, which a lot of them do, is polysorbates being a substance in the vaccines that can lead to an anaphylactic reaction. There is some thought that that might be what's behind the Pfizer episode, but it's very rare. Polysorbates are everywhere, and it's very rare to have this particular allergy. In fact, the only way to know whether you have an allergy is to get the vaccine. And if you happen to be one of the very, very rare people who gets an anaphylactic, a serious, like Dr. Lacerda is saying, serious allergic response, then we know what to do. We know how to treat that, and it will affect it'll affect the second vaccine as well.
Yeah, and for those who are are considering this, who may have a history of anaphylactic reactions, part of the clinic setup is for medical monitoring. So individuals are monitored for a minimum of 15 minutes or up to 30 minutes, provided they have any history of any severe allergies. So another question that had come through was some concerns with, taking Tylenol or ibuprofen before and or after an injection, and as well as someone had heard that there was a need to avoid alcohol after an injection. So I'm not sure if anybody on the panel has any information or can kind of weigh in on those questions. If not,
I think generally Tylenol or ibuprofen will help with the symptoms that you get afterward. I don't know about taking it beforehand, but I had, the second dose, I had some mild achiness and tiredness, and ibuprofen made me feel better. I didn't have any negative but I'm old and I take ibuprofen twice a day anyway. So
yeah, the CDC did recommend against taking Tylenol or any of the ibuprofen type like medications before as a preventive measure. If people are taking those medications because they need to for some reason, they don't need to stop taking them before the shot. But to take it because you want to prevent the side effects is not recommended, based on some pretty weak studies, quite frankly. But that's what the CDC is telling us. So that's what we're telling our patients. Afterwards, of course, any of those medications can be useful for the side effects.
I would suppose that the logic is, if people are concerned about that if you get the vaccine and you have a fever, but you take an antipyretic or an anti-fever medicine, you're going to diminish the effectiveness of the vaccine by getting rid of the fever. There's nothing virtuous in that fever, and it isn't the fever that is ridding you of a virus. So for symptomatic relief, whatever helps your symptoms, I think is safe.
And the alcohol thing, that was a theoretical concern. I looked into it just to see if there's any evidence for it. There really isn't. So, I mean, the recommendations are, alcohol consumption in moderation. Excessive alcohol definitely can affect your immune response. So, sometimes we have to deal with alcohol as the problem. But there doesn't seem to be any problem with moderate alcohol consumption.
And so now that, kind of as we're moving along here, now people have been, hypothetically vaccinated in our midst of our conversation, about, and Dr. Lacerda, about how long after an individual receives, a dose, the one dose of the Johnson & Johnson or the a second dose of a Pfizer or Moderna vaccine, how long after are they considered immunized?
Roughly 2 weeks. 2 weeks after you get your second dose of Moderna or Pfizer, 2 weeks after you get the one dose of the Johnson & Johnson vaccine, you're considered to be immunized.
And there were some questions coming through as well about, what if I only get one dose of the Pfizer or Moderna? Is that effective?
There is some efficacy with that. The thing is that so far what we know is all of those patients that got a first dose got a second dose in the clinical trials. So we don't really know what is the long-lasting efficacy of that, but there has been numbers thrown around and speculated of an 80% efficacy, although this is a short period of time between dose 1 and dose 2, so we could not be conclusive. I assume, and this is my personal opinion, that if you get one dose, you will have some immunity, but I wouldn't recommend that you go with one dose of the Moderna, of the Pfizer. As of now, we don't have enough evidence to tell people that one dose is going to be enough. The Johnson & Johnson obviously is one dose. If you cannot get a second dose because of a reaction, which I think is an important message to give the public. Let's say you get the first dose of Pfizer or Moderna and you got a reaction to it, and you cannot get a second dose because of that, then you could get a dose of the Johnson & Johnson. And this part of the recommendations that CDC is putting out there. If you couldn't complete your cycle with the Pfizer or Moderna, consider getting the Johnson & Johnson vaccine to complete your immunization schedule.
And just to reiterate, with the Pfizer vaccine, it is 21 days between first and second dose, and then for the Moderna vaccine, it's a 28-day period. And again, the guidance is to get it as close to that timeline as possible. But like Dr. Lacerda had mentioned, if you can, or if there's any issues, you wouldn't have to repeat the series. You would just get it as close to that timeline as possible.
Correct.
So another question was about, are the COVID-19 vaccines safe for children? So I know that, and just to kind of get the timeline and ages out there, the Pfizer vaccine is authorized for people 16 and over, and the Moderna and the Johnson & Johnson vaccines are authorized for people 18 and older. But is there, if anybody could weigh in on this, the studies that are happening right now with the populations younger than 18?
No real data yet on children. The studies are ongoing, and that's why they're not being recommended for children yet. I expect that in the coming months, we're going to have those studies completed. We're in the middle of the pandemic, so the enrollment is very quick. So we'll have that information in the months to come. But as of now, we don't have definitive evidence to recommend it to children yet.
And I know that there has been a lot of questions coming through as well about so I'm fully vaccinated. Now what can I do, or what security blanket do I have, or what public health measures do I need to continue? So maybe Dr. Vaught, as my fellow MPH, or if you want to kind of weigh in on some of those public health measures that still need to potentially be taken after a vaccine, after you're fully immunized.
Yeah, that's a great question, and it continues to come up as the question of when can I take my mask off? And I think even as of this week, the CDC is now putting out new guidance as far as when we can take our masks off when we're in close proximity to those that have been fully vaccinated. And so what I'll go back to when they did the vaccine studies, they were looking at preventing severe disease requiring hospitalization. And then what was unknown at the time and when we started this was, could you still be a carrier of the disease and therefore infect others who had not been fully vaccinated? And so as we get more information and as we see the hospitalization rates and COVID-related ICU admissions decrease, I think what you're going to see is a rollback of many of the public health measures that we've put in place regarding wearing masks, social distancing, group gathering, first small group gatherings and then large group gatherings. And so in the coming months, you can expect to see a progression and a very thoughtful progression of rolling back some of these public health measures that have been put in place. Now, with all that being said, I think we've learned a lot about COVID and the spread of infectious disease. And while infections have been around for centuries, anytime something like this happens, we become much more acutely aware. So I think about things like the way we interact with other individuals as far as personal space or shaking hands or greetings. And some of those things may be forever changed based off of the thought of how can I help prevent future infections from influenza or coronavirus or any other disease that's commonly passed during the winter season.
And I think, you know, when you look at some of these things, you have to look at, you know, what's the risk? You're not gonna have someone tell you there's zero risk anymore. So, you know, the CDC gave out recommendations recently, like Dr. Vought said, about, you know, if you're in a group with everyone vaccinated and you're in a, you know, in an office or home and everyone's vaccinated, you don't need the masks anymore. But it says it puts you at relatively low risk. It doesn't say there's zero risk. So everyone has to kind of use common sense there. And if you're with people who aren't vaccinated, who may be in a higher risk group, then the recommendation would be for people to still wear masks. And, you know, that may change again in the future. And some of the other benefits to getting vaccinated, aside from not dying and not going in the ICU, you know, some offices and some businesses may require it of their employees that you be vaccinated in order to keep your job. And some people say, you know, question if that's legal or not, and it is. You may need it to travel. So everybody's waiting for these restrictions to be lifted and they want to go some places. You don't know if there'll be requirements to be vaccinated to do certain things. So I think when people are putting all this information together to decide whether or not they're going to be vaccinated, which we all think is, you know, an easy decision, but you have to take a lot of these factors into consideration.
Definitely need to try and encourage everybody to take advantage of the vaccine, but like you both mentioned, you know, these public health measures until the majority of the population is vaccinated are going to be really critical, especially and as Dr. Vought mentioned, you know, we do still have disease transmission here in Fall River. You know, our percent positivity rate was over the last 14 days was 4.26%. So, you know, we are, you know, still a bit higher than the state average. So, you know, we as a community certainly need to keep that in mind. Well, thank you all for this great discussion. I really appreciate it. Does anybody have any kind of final thoughts from our panelists that they'd like to share before we begin to wrap?
I think one thing, you know, especially now they just added in the teachers, and you know that's a large group of people, and Massachusetts specifically doesn't have a whole lot of a whole lot of vaccines available, and we're still trying to get through the other phases. So if you have a hard time getting an appointment, don't give up. Just keep on checking. Even if your phase has passed, keep on trying. Eventually you'll get your opening and get your appointment and get your vaccine. But in the near future, it may be a little difficult because they opened it up to a lot, and unfortunately we don't have a lot of vaccine, but keep on trying.
Yeah, I'd like to reiterate that too. Our biggest limitation right now is getting the vaccine. And Fall River, even though it has been a hotspot for COVID, really has not gotten any of the enhanced vaccination supplies from the state that we might have hoped for. So I think, yeah, talk to your representative, send a message up to Boston that Fall River needs vaccines.
I echo that. I really want to thank everybody for participating today. It was very informative. I hope we get some people that have a little better understanding of vaccinations. And I know everybody on the screen has been doing yeoman's work since the day this started back in February or March. So I really appreciate it, and I can't thank you enough. Thanks, guys.
You're welcome.
Thank you, Mayor.
Thank
Thanks, Tess.
you.